I had a patient come in recently with a condition called hand eczema, and it affects people's ability to go to work. And this was a patient where I thought, okay, we're probably not even going to need a prior authorization. I can write you for a generic topical cream that's going to make this better in a matter of days. And even that prescription required a prior auth, so they got to the pharmacy and couldn't get treated for over a week. And that was additional time that they missed work. That was additional time that they were miserable.
It's pity. I mean, you feel badly for the patient, the family, the caregivers too. It's not just the patient. Mom and dad may have to take time off from work.
Diabetes causes bleeding in the eye, especially if the diabetes is uncontrolled. If they're still employed, they can't see to drive themselves to work. They stop by the office. They're begging for help, but they just can't walk in and get an appointment as much as we'd love to give it to them because we need an authorization for that visit from their health plan. It didn't used to be that way.
I have patients driving 2 hours to see me for internal medicine. Prior authorization, oftentimes that may take 2 or 3 days. So that means they go home and come back for a test that I know is going to be approved. For working class families, it's very typical that they can't come back.
You know, we work as hard as we can to get them out of the hospital. When that doesn't happen because of prior authorization, it's really disappointing. It's like $1,000 for a hospital stay overnight, and you're just doing that to save a few dollars on a medication.
A lot of employers pick insurance plans for their beneficiaries, for their patients, and they need to understand that when they're picking those plans, if people have certain diseases, there cannot be restrictions or prior authorization schemes that keep people from getting the drugs that they need. And that's where things can be impactful. When an employer calls their insurance plan and says one of my employees is having a problem, that can actually make things happen.